Okay, we're going to talk about cancer this week, and we are covering Chapter 50 in the 5th edition of Darby and Walsh, and Chapter 45 if you're using the 4th edition of Darby and Walsh. These are the objectives for this week, and this is the outline of the discussion. So why this information is important. You'll see many patients who have either had cancer, they either have had it in the past, they currently have it, or they have had somebody in their life who's had cancer. So cancer touches many people, and so the likelihood of you encountering it in your dental hygiene career is very high. So as a dental hygienist, you will need to understand the oral, physical, and physiological issues surrounding a patient who is currently battling cancer or who has survived cancer. You may also end up helping somebody whose loved one has cancer and is having a problem. They may share something with you and you may be able to help give some recommendations. So cancer terminology. Cancer is not a single disease, but a broad classification over 100 types of different diseases. Cancer is an abnormal and unrestricted growth of cells that can invade and destroy surrounding normal tissue, sometimes spreading to other parts of the body. That's what we call it when it metastasizes. Benign tumors are circumscribed and encapsulated. They usually are very slow growing, and they're composed of cells that resemble the tissue that they arise from. A malignant neoplasm, or cancer, in other words, it infiltrates locally but has potential to metastasize throughout the body, to different parts of the body. They are atypical or dysplastic and may not resemble the parent tissue, so they turn into something of their own making. Metastasize means to spread to distant sites, to go from, starting out as breast cancer and then going to bone cancer or something like that. Oncology is the study and treatment of cancer, and an oncologist is a physician who specializes in the treatment of cancer. Cancer risks, risk factors. So carcinogens are cancer-causing influences. They can be found in the environment, such as alcohol, chemical exposure, radon, radiation, sunlight, hormone, different hormone issues, and asbestos. And then behavior. Risk factors that are behavior related would be tobacco use, excessive alcohol use, obesity or chronic overweight, poor nutrition and inactivity. Viral factors would be hepatitis B and HIV, and the biggest one that we hear a lot about nowadays is HPV. And then there's a genetic component as well. And in the U.S., only heart disease causes more deaths in adults than cancer. Early signs and symptoms of cancer, you would notice things like, or your patient would notice things like change in bowel and bladder habits, a non-healing sore, unusual bleeding or discharge, thickening or lumps, indigestion or difficulty swallowing, obvious changes in a wart or a mole, and a nagging cough or a hoarseness. The rise in oropharyngeal cancers is very highly linked to the human papillomavirus, or HPV. Adults under 45 are starting to have more oral cancers due to this virus. Location is in the throat, back third of the tongue, soft palate, side and back walls of the throat, and the tonsils. Early signs and symptoms of oral cancer would be swelling, lumps, or growth. Often they're painless. Induration or a hardness. Painless, so some kind of a lump or a growth that starts to just get noticed or bother them once it grows big enough to do so, because it may not cause pain. Erythroplakia or leukoplakia, a sore in the mouth that does not heal after 2 weeks. Remember, the mouth heals very quickly, so if the conditions are, normal, so a sore that's not healing is unusual. Repeated bleeding from the mouth or the throat, difficulty swallowing or hoarseness. Common sites to find oral cancer are the lateral borders of the tongue, the ventral surface of the tongue, the floor of the mouth, and then way back in the throat, the oropharynx. What do you think could prevent you from doing a thorough eoio in private practice? There's a lot of things that are going to start moving very quickly in your day-to-day, and one of the first things that tends to go, unfortunately, for many, many hygienists is a thorough eoio. You, of course, do it in clinic because partly because you have to, because we want to try and instill the importance of it. But you'll find when your day speeds up, you start cutting things, and one of the first things you cut is a really methodical, thorough eoio very often. So then you want to think about, before those circumstances happen, before you get into your busy practice, what can you do to help mitigate that, help prevent you from not doing it at all, which would be the worst, or doing a very brief version. There are ways to incorporate your eoio in under 2 to 3 minutes, or even less. I mean, honestly, if you become very, very, very routine about it, it can be done very quickly. And then, of course, you do have the opportunity to be looking around constantly as you clean your patient's mouth. So just being sure that as you retract, and you're always reading the tissue, always looking over the tissue. You know what's normal, so always let anything that is abnormal in the inside of their mouth or on their face jump out at you. Train yourself to look for things that are abnormal. Cancer therapies. So the goal is to remove or destroy the cancer cells in the body, and the types of therapies include chemotherapy, bone marrow transplant, radiation, surgery, blood transplant, or we already said bone marrow, but blood transplants, hormone therapy, immunotherapy, target therapy, and stem cell transplantation. In the 5th edition, I can't remember if it's in the 4th, but the 5th edition gives a brief overview of each one of these, so I encourage you to go there and and most everyone knows what chemotherapy is. It's, chemical therapy, some kind of drug. And bone marrow transplant we'll talk a little bit about next, or in a couple slides. Radiation therapy, I have some familiarity with that as well. And of course, surgery, trying to remove the cancerous tumors. But some of these other ones, therapies, you might want to just glance over and try and get a better kind of just basic understanding of those. Treatments target not only the cancer cells, but also normal healthy tissue sometimes has to be destroyed. And so that's why people get sick during their cancer therapies, is because a lot of the therapies are targeting the cancer cells, but at the same time, their healthy cells are dying as well. A biopsy is a surgical removal of part or all of a lesion that they're testing to see what kind of cancer, what stage, that sort of thing. Chemotherapy using drugs. So most common complications of chemotherapy would be infections due to your decreased immune response. The result is myelosuppression, or a suppression of the bone marrow that has to do with the immune response. Other complications would be electrolyte imbalances, bleeding or hemorrhaging, acute toxicity, which can result in nausea, vomiting, photosensitivity, central nervous system dysfunction, alopecia or hair loss, and poor nutritional status. Increased likelihood of sepsis, periodontal disease, pulpal disease, and pericorneal disease during chemotherapy. People become very fragile during chemotherapy. Bone marrow transplant, or BMT, is used to treat hematologic diseases such as aplastic anemia, leukemia, lymphomas, neuroblastoma, immunodeficiency diseases, and some solid tumors as well. The bone marrow, blood is produced in the bone marrow, and so that's why they go to try and kill off all the cancerous blood and then impart new healthy blood to try and take over the body. So the process is a conditioning phase first prior to the BMT. That involves high dose chemo and radiation, destroys malignant cells, and suppresses the immune system. The immune system has to be suppressed in order to accept this bone marrow transplant. permits the engraftment of healthy bone marrow and blood stem cells via IV. Oh shoot, hold on. I don't know if I'm still recording though. Am I still recording? Sorry if you are listening to me. I don't know if I'm actually still recording. Oh, I guess I am. All right, sorry about that. Okay. Let's see. So once they have done the transplant, once they've conditioned the body, suppress the immune system to try and take the graft, then the body can start producing new marrow within 2 to 4 weeks. Bone marrow transplant, there's something called a graft versus host disease, GVHD, and this occurs when receiving from a donor. So the donor cells react against the host tissue. So it's kind of like almost a rejection, basically, or a reaction, and not necessarily a complete rejection, but just the body starts saying, who is this? What is this? Is this a disease? What do I have to fight against something? So the donor cells start to react once they come into the body. And so acute would be within the first 100 days. Things that might be apparent is a dermatitis, so skin conditions, enteritis or hepatitis, the liver, or oh my gosh. Okay, never mind. I'm moving on. Xerostomia can occur, mucositis, ulcerations, a hemorrhage, lupus-like lesions, atrophy of the mucosa, and opportunistic infection. So that's really acute, comes on fast. And then a chronic would be something that continues after the first 100 days. So this kind of manifests more like an autoimmune disorder. The skin diseases, and oral mucositis, salivary gland dysfunction, esophageal and vaginal strictures, pulmonary insufficiencies, intestinal problems, and chronic liver damage. So there's so many different body parts that can be affected in this sort of autoimmune-like disorder condition that can arise after a bone marrow transplant. So the goal is to prevent it, various types of immunosuppressive therapies. So the goal is to suppress the immune system so it doesn't react, so that these things don't start to come to the surface and the body doesn't kind of fight against it. So patients who are scheduled for bone marrow transplant should undergo a thorough oral and dental evaluation and necessary treatments before transplant. So any infection, any potential to replace crowns or fillings, or any areas of decalcification or periodontal disease needs to get under control. All potential sources of infection and irritation should be treated, because chronic asymptomatic oral infection may become acute during immunosuppression. So you suppress the immune system, and then these infections can just go crazy. So GVHD, the oral infections may become acute during, if they start to have the graft versus host disease. So that can also then lead to sepsis or even death. So it can be a kind of just a spiraling nightmare. So any potential for there to be any kind of infection or any kind of irritation, from a denture or anything like that, needs to be dealt with before they go under this therapy. Chemo and bone marrow transplant oral considerations. So oral mucositis is a big one. Burning, pain that interferes with talking, swallowing, nutrition, eating. It can be so painful. If you've heard anybody's stories of surviving cancer, and especially something that had affected their oral mucosa or caused mucositis, it can be so debilitating. Eating can be so painful. They just can barely do it. Neurotoxicity that can result in deep, severe bilateral pain. The nerves just are just can feel like they're just on fire. It's just a horrible pain in the face. And then infection, fungal infection, viral infection, bacterial infection, bleeding or hemorrhaging. This can result from myelosuppression, resulting in thrombocytopenia or, the thinning of their blood. Salivary gland dysfunction. Not all suffer from xerostomia, but the thickened secretions or drooling, there could be different manifestations besides just xerostomia. Dental caries related to dry mouth or a carb diet. Altered tooth development before the age of 10 or especially before 5. So if a child goes under chemotherapy, it can affect tooth development. Oral considerations, preventing and managing oral complications, helps to support optimal cancer treatment, enhance patient survival and quality of life. So why do you think this is? If we are helping them to stay comfortable, helping them to keep their oral environment comfortable and healthy, how can that help them with their treatment? So if we're in class, I'd give you a minute to think about it, but oral side effects of cancer treatment that result from unintended disruption and destruction of healthy tissue can be so debilitating that a patient might actually only tolerate a lower level of their cancer treatment because they just can't deal with the side effects. So if we can help their oral environment stay more comfortable, they might actually be able to tolerate the cancer treatments better. Mucositis. So chemo may be toxic to the oral mucosa, may cause edema, inflammation, and ulcerations. Patients can report burning pain, general discomfort, can interfere with talking, swallowing, and obtaining proper nutrition, like we said earlier. Management of this: keep oral environment moist and clean. It cannot be allowed to just dry out and build up bacteria. Good overall nutrition. Things like juicing. Oh my gosh, just juicing vegetables and greens to give them the nutrition because eating is so uncomfortable. So smoothies and juices and things that are moist are so important for cancer patients. Control secondary infections and things like candidiasis and other secondary infections. Patient to rinse with saline and sodium bicarbonate. That helps to neutralize the pH. Alcohol-free for sure. Use mild topical analgesics. May progress to a systemic analgesic if they need to. They used to make something called magic mouthwash. They still might, and something that they can rinse with. They'd give it to oral cancer patients, and it would have like a numbing effect. This is from from the 5th edition, Management of Mouth Pain from Mucositis. It says, early detection and treatment of oral infection, good oral hygiene, including tongue brushing to prevent further infection, frequent irrigation with a teaspoon of baking soda, teaspoon of salt, and 32 ounces of water, frequent rinsing with sodium bicarbonate mouth rinses and non-alcoholic mouthwashes, Biotine, Spry, alcohol-free mouthwashes, daily cleaning of dentures and changing of soaking solution to remove the dentures while sleeping for sure, use of prescribed topical anesthetics with caution to avoid anesthetizing the soft palate, which could cause food aspiration. Excessive use may potentiate mucositis. So topical anesthetic could be irritating if they use too much of it. Use of over-the-counter or prescribed systemic analgesics if necessary. Avoidance of irritating or rough textured food, keeping it sort of smooth and soups and smoothies and things like that. Use of perioral moisturizers as directed by the radiation oncologist. Neurotoxicity. Neurotoxicity is damage of nervous tissue caused by toxic substances. So chemotherapeutic agents that are derived from plant alkaloids are actually toxic to nervous tissue. So it may cause this severe, deep pain that we talked about earlier, often bilateral, odontogenic-like pain. So it might feel just like they've got like a mouthful of abscesses or something, just really severe. Pain subsides a few days after the drug is administered. So, they get that initial toxicity, and then it sort of dissipates a bit. Infection, when bone marrow is suppressed, or immunosuppression and bleeding problems, risk of developing oral infections. Of course, bacterial, viral, and fungal would be a big one. Increased risk of systemic infections that could lead to death or sepsis, and then intensifying mucositis. So, infection, of course, is a big concern with the suppressed immune system. So management, the oncologist could decide the safest time to schedule dental hygiene appointments. If the patient, you probably won't see a patient in the throes of intense cancer treatment unless the oncologist actually feels that it's really important, or they're maybe consulting you for some advice on how to handle mucositis or something. May recommend pre-med, central venous catheter. If they have a central venous catheter, they may need a pre-med. Stop brushing and flossing is a controversial statement, but there are other ways to remove bacteria gently without causing trauma. Things might be so painful and just fragile that brushing and flossing in a traditional way is just not an option. So then we look at the ultra soft, the swabs, the rinsing, the wiping, things like that. There's just other mechanisms that we can go to try and figure out the best way to help a patient remove bacteria. Denture wearers, evaluate the frequency. Dentures have to come out at night, soak them to disinfect them, and evaluate for any irritation, so that irritation doesn't cause a sore that can lead to other problems. All right, let's stop there at 20 minutes and pick up in a second here.